Picture this. You're in a medieval marketplace, and the sound that cuts through all the noise isn't a merchant hawking his wares or children playing, but the bone-chilling scream of someone having a tooth pulled. There's no dental office, no sterile white room, just a burly tooth puller gripping a pair of iron pincers while his assistants hold down a writhing patient, whose mouth is already bleeding. The dentist works with brutal efficiency, knowing that speed is the only mercy he can offer. Within seconds, the rotten tooth is out. The patient is given a rag soaked in wine to bite down on, and the next sufferer steps forward. This was medieval dentistry. Fast, brutal, and absolutely necessary. But how did they do it? How did medieval people endure procedures that would leave modern patients unconscious from pain? And how did tooth pullers manage to help their patients survive what should have been unbearable torture? The answer lies in a sophisticated understanding of pain management, herbal medicine, and human psychology that developed over centuries of necessity. Medieval people couldn't avoid dental problems any more than we can, but they couldn't rely on modern anesthesia, antibiotics, or sterile techniques either. Instead, they created an entire system of dental care that combined natural pain relief, psychological preparation, and community support to make the unbearable somehow bearable. They proved that human ingenuity and determination could overcome even the most extreme physical challenges when survival was at stake. Medieval tooth extraction was an urgent necessity rather than elective healthcare, because dental infections could and frequently did kill people through sepsis, brain abscesses, and other complications that spread from untreated oral disease. Rotting teeth weren't just painful inconveniences, but potentially fatal medical emergencies that required immediate intervention regardless of available pain relief options. People chose the agony of extraction over the certainty of death from infection, making pain tolerance a survival skill rather than a personal choice. The most effective medieval pain relief came from sophisticated herbal preparations that provided genuine aesthetic effects through combinations of naturally occurring drugs. Opium poppy extracts offered powerful pain relief that could render patients semi-conscious during procedures. Mandrake root contained alkaloids that produced sedation and pain reduction. Hemp and other cannabis preparations provided both pain relief and psychological calming effects that helped patients endure traumatic procedures. But here's where medieval dental pain management becomes truly fascinating. Skilled practitioners understood that effective anesthesia required precise dosing, proper timing, and individual patient assessment that took into account body weight, pain tolerance, and medical condition. They developed standardized herbal recipes that balanced effectiveness against safety, understanding that too little medication left patients in agony while too much could cause respiratory depression or death. Master tooth pullers guarded their pain relief formulas as closely as modern pharmaceutical companies protect their drug patents. The preparation of herbal anesthetics was an art form that required extensive knowledge about plant identification, harvesting techniques, processing methods, and storage requirements that maintained potency over time. Practitioners had to know which parts of plants contained active compounds, when to harvest for maximum effectiveness, and how to extract and concentrate active ingredients using medieval technology. They developed testing methods that allowed them to assess the strength of their preparations and adjust dosages based on individual patient needs. Alcohol played a crucial role in medieval dental anesthesia, not just as a crude pain reliever, but as a sophisticated delivery system for herbal medications and a sterilization agent that reduced infection risk. Strong wine or spirits served as solvents that extracted active compounds from medicinal plants while providing their own analgesic effects. Patients were given measured amounts of medicated alcohol that produced controlled intoxication that reduced pain perception and anxiety, while maintaining enough consciousness to cooperate with treatment procedures. The timing of alcohol and herbal administration required careful coordination between the tooth puller and his assistants to ensure maximum effectiveness during the critical moments of tooth extraction. Medications were given in stages, with initial doses providing general relaxation and pain reduction, followed by additional doses timed to peak effectiveness during the actual extraction procedure. This sophisticated approach to pain management required understanding of drug absorption rates and duration of action that rivals modern anesthetic protocols. The psychological preparation of medieval dental patients was as important as physical pain relief. because fear and anxiety could multiply perceived pain and make procedures more difficult for both patient and practitioner. Experienced tooth pullers developed elaborate pre-procedure rituals that helped patients mentally prepare for the ordeal, while building confidence in the practitioner's skill and the likelihood of successful outcomes. Religious frameworks provided powerful psychological pain management tools that helped medieval patients endure dental procedures by placing their suffering within spiritual contexts that gave meaning to their pain. Prayers, religious relics, and spiritual counseling transformed dental extraction from meaningless torture into religious devotion that could earn divine favor and spiritual benefits. Some patients viewed dental pain as penance for sins, or as tests of faith that demonstrated their worthiness for salvation. Community support systems surrounded dental procedures with social networks that provided practical assistance and emotional encouragement throughout the treatment process. Family members, friends, and neighbors gathered to provide physical restraint when needed, emotional support during procedures, and post-treatment care that aided recovery. These community networks created shared responsibility for patient care that distributed the psychological burden of dental treatment across multiple people, rather than leaving patients to face their ordeals alone. The tools used for medieval tooth extraction were surprisingly sophisticated and represented centuries of technological development, aimed at minimizing extraction time and maximizing success rates. Different types of forceps were designed for specific teeth and extraction situations, with specialized grips, angles, and leverage systems that allowed practitioners to remove teeth efficiently while minimizing tissue damage and patient trauma. The crafting of dental instruments required specialized metallurgy and tool-making skills that produced implements capable of gripping smooth, wet tooth surfaces, while applying the enormous forces necessary to break periodontal ligaments and remove teeth from their sockets. Master toolmakers developed alloy compositions and heat treatment techniques that created instruments with optimal hardness, durability, and resistance to corrosion from blood and saliva. The technique of medieval tooth extraction emphasized speed above all other considerations, because prolonged procedures increased pain, infection risk, and the likelihood of complications that could threaten patient survival. Skilled practitioners could remove most teeth in under a minute, using techniques that combined proper patient positioning, optimal tool placement, and coordinated pulling motions that broke teeth free with minimal trauma to surrounding tissues. Master tooth pullers developed signature extraction techniques that became famous throughout their regions and attracted patients from considerable distances seeking their services. These specialized approaches often involved unique tool modifications, patient positioning methods, or procedural innovations that improved success rates and reduced patient suffering. The most skilled practitioners could extract multiple teeth in single sessions while maintaining patient cooperation and minimizing complications. The guild system that controlled medieval dental practice created standardized training programs, quality control measures, and professional ethics that regulated tooth puller services while protecting practitioners from competition by unqualified operators. Dental guilds established apprenticeship requirements, examination procedures, and licensing standards that ensured basic competency while maintaining professional secrets that gave guild members competitive advantages. Guild regulations covered pricing structures, service standards, and professional conduct requirements that protected patients from fraud and incompetence while ensuring that tooth pullers could earn reasonable livings from their specialized skills. They established procedures for handling patient complaints, resolving disputes between practitioners, and maintaining professional reputations that were essential for successful dental practice. The economic realities of medieval dental care created tiered service systems that provided different levels of pain relief and procedural comfort based on patients' ability to pay for premium services. Wealthy patients could afford the finest herbal anesthetics, the most skilled practitioners, and elaborate post-procedure care that minimized their suffering and maximized their chances of successful recovery. Poor patients received basic extraction services with minimal pain relief, often relying on alcohol, prayer, and personal endurance to survive procedures that wealthier patients would find unthinkable. However, even basic medieval dental care was often more effective than no treatment at all, and community support systems ensured that even the poorest patients received some level of care during dental emergencies. The social status of tooth pullers reflected their unique position as skilled craftsmen who performed essential but frightening services that few people wanted to do themselves. They enjoyed higher incomes than many other tradesmen, but faced social stigma from association with pain, blood, and bodily functions that made many people uncomfortable. Successful tooth pullers could achieve substantial wealth and community influence, but they remained outside elite social circles due to the manual nature of their work. Professional tooth pullers often expanded their services to include other medical procedures that utilized their pain management knowledge and manual skills. Many became general surgeons who performed wound treatment, bone setting, and other procedures that required similar combinations of speed, skill, and pain management expertise. Some specialized in particular types of dental work, such as jaw surgery or treatment of facial injuries that required advanced surgical techniques. The training of medieval tooth pullers involved years of apprenticeship that combined technical skill development with psychological preparation for a career spent inflicting necessary pain on fellow human beings. Apprentices learned not just extraction techniques and tool use, but also patient psychology, pain management, and emotional coping strategies that allowed them to function effectively in their challenging profession. Master tooth pullers taught apprentices to balance professional detachment with human compassion, understanding that successful practice required both technical competence and emotional resilience. They shared techniques for managing their own psychological stress, while maintaining the steady hands and clear judgment necessary for effective patient care. The most successful practitioners learned to view their work as essential healing, rather than torture, finding meaning in their ability to relieve suffering, even through temporarily increasing it. The seasonal patterns of medieval dental practice reflected agricultural cycles and economic rhythms that determined when people could afford dental care and when practitioners were most available for treatment. Harvest seasons and market days brought together the resources and opportunities that made dental procedures possible for rural populations who might otherwise lack access to professional tooth pullers. Urban dental practice operated year-round, but experienced peak periods during religious festivals and fair days when people gathered in large numbers, and temporary dental clinics could serve multiple patients efficiently. These concentrated practice sessions allowed tooth pullers to maximize their incomes while providing services to people who couldn't normally access professional dental care. The geographic mobility of medieval tooth pullers created networks of traveling practitioners who brought dental services to remote areas that couldn't support permanent dental practices. These itinerant specialists developed portable equipment, abbreviated procedures, and emergency treatment protocols that allowed them to provide effective care under varying conditions and resource constraints. Market towns became centers of dental activity during fair periods, when traveling tooth pullers established temporary practices alongside other commercial activities. These seasonal dental clinics provided opportunities for people to receive treatment that they had been postponing due to lack of local services, creating concentrated periods of dental activity that required specialized crowd management and emergency response capabilities. The military applications of dental knowledge made tooth pullers valuable members of army medical units, who could treat battle injuries involving facial trauma, broken teeth, and jaw injuries that were common in medieval warfare. Military dental specialists developed techniques for treating combat-related dental problems under field conditions while maintaining the rapid treatment schedules necessary for maintaining army effectiveness. Siege warfare created particular challenges for dental care, as extended military campaigns led to dietary deficiencies and stress-related dental problems that required treatment under resource-constrained conditions. Military tooth pullers learned to work with limited supplies, improvised tools, and minimal facilities while maintaining treatment effectiveness that kept soldiers combat-ready. The decline of traditional tooth-pulling practices resulted from advances in medical knowledge, improved surgical techniques, and the development of more effective anesthetic agents that made dental procedures less traumatic and more predictable. However, many traditional pain management techniques and extraction methods continued to be used well into the modern period, particularly in rural areas where access to formal medical training was limited. Medieval dental practices established foundations for modern oral surgery, pain management, and dental public health that continue to influence contemporary dental care. The emphasis on rapid treatment, effective pain relief, and community support systems evolved into modern dental practice approaches that prioritize patient comfort and treatment accessibility. Most importantly, medieval tooth pullers demonstrated that effective healthcare can be provided even under primitive conditions, when practitioners possess adequate training, appropriate tools, and commitment to patient welfare. They proved that human ingenuity can develop sophisticated solutions to medical challenges using available resources and accumulated knowledge, rather than advanced technology. So how did medieval people remove teeth without modern anesthesia? They developed sophisticated pain management systems that combined natural medicines, psychological preparation, and community support to make unbearable procedures somehow survivable. They created dental practices that emphasized speed, skill, and patient care while working within the severe limitations of medieval medical technology and understanding. They understood that dental care was essential for survival and developed treatment approaches that balanced effectiveness against available resources, creating healthcare systems that served their community's needs, while pushing the boundaries of what was possible with medieval knowledge and technology. They proved that human determination and professional skill could overcome seemingly impossible medical challenges when the alternative was suffering and death. The next time you visit a modern dentist and appreciate the comfort of local anesthesia, remember the medieval patient who bit down on a leather strap while a tooth puller worked with brutal efficiency, relying on herbal medicines, strong wine, and extraordinary courage to endure procedures that modern medicine would consider unthinkable without proper pain control. If you enjoy the hidden sides of medieval life, hit subscribe and give this video a like.